So thanks for watching today. I have the special pleasure of introducing a patient I've known for many years. Her name is Jennifer, and Jennifer, I'd love you to tell your story and share it with people what's happened in your life.
Yeah, thank you. I remember starting to see you in 7th or 8th grade. And I'm 41, so it was a very long time ago. I remember my parents testing me for ADD because I couldn't concentrate in math, and they ended up putting me on Ritalin. And Ritalin had the opposite effect of what it should. So after I took it for the next hour, I would be running on the treadmill because I had so much energy to burn off. And then after that, I would go into this deep depression and stay in my room, listen to sad music.
And how old were you then?
I was, I believe, in 6th grade.
Okay.
Well, no, it was a couple years before that, so maybe 5th grade or so. And so I was depressed, and I even had a suicidal thought once or twice. I don't know if I would have ever gone through with it, but just very depressed. So at the time, they made you see a psychiatrist while you were taking Ritalin. So I was telling him about all of my behaviors and what was happening, and he said for a couple of years, hey, that's normal. It's all normal. And my mom and I kind of thought, no, that's not normal. And one day out of the blue, he said, no, that's not normal. So she had seen you because she was dealing with her own depression issues, and you put her on Zoloft, and that was a miracle. So I came to see you about that, and that started actually, I think it took 10 years? No, it took quite a few years to get the medication right and the dosaging, but we did it, and we got there, and we got it all stable.
So now, when you first started me, how old were you at that point, about more or less?
I was maybe 9th grade,
Okay.
8th, 9th grade.
And then were you I'm assuming you still weren't on Ritalin by that point.
No, at that point, my mom had taken me off.
Right. So So it was a misdiagnosis because there's other reasons to be distracted, than just ADD. The tip off that was a wrong diagnosis is her reaction. So Ritalin is a pretty much the mildest, about the mildest ADD medication that there is. Milder, definitely gentler than Adderall, and so when she has a reaction like that, it's not truly ADD, it's a wrong diagnosis. So you're not supposed to be speedy, you're not supposed to be crashing in this, and so it's a misdiagnosis. When ADD is correct and you have the correct ADD medication, it should be calm focus. It should be like just relaxed, and so that's not the reaction she had. So that's the way of knowing. So the fact that you were on the wrong medication for way too long, that's not good. That wasn't good.
No.
So obviously the doctor didn't recognize that, wait a minute, this is not the reaction that she's supposed to be having. And
right.
So that's unfortunate. So tell me about then, after that, when you started taking things, what age were you when you started getting treated then? So
you started treating me, I believe it was like 8th, 9th grade. We just started with Wellbutrin and Effexor, and we just went down the list of medications, and it was, okay, this one doesn't work, and this one doesn't help me sleep, because I've had insomnia since a child. I would sit there at night and just count the, ceiling tiles, and so it was just a whole bunch of different medications that we tried, and finally, Zoloft did it for the depression part of it, and we finally got the Mirtazapine for the sleep in there, and there we go.
So Mirtazapine, which is also Remeron, it's also an antidepressant, but it's really, really good for sleep. It's great for sleep quality. Again, I had tried Effexor, and if you watch the show, I'm a huge fan of Effexor. It wasn't for her. So you have to be flexible, and the Effexor wasn't right, the Wellbutrin wasn't right for her, because I learned that, okay, it's not dopamine, it's not norepinephrine, and so that's why I eventually put you on Zoloft, and then And then the Remeron just, is just great for sleep, and it's good for mood too. It's not a traditional sleeping pill, but it's great for it.
Yeah.
Great for sleep quality. I think you're also on Topamax too.
Yes, I was getting really bad migraines, and you put me on that.
And that resolved them.
Yes,
Yeah.
I've only had one bad migraine in 9 years.
So going back to what was the first age you started, feeling like mood wise? You said about in ninth grade or so, or what was the?
So the depression part of it was with the Ritalin when I started it in 5th, 6th grade.
Right.
But yeah, that's kind of where it started. Just because I noticed I'd get really sad and I'd need to listen to sad music, and then I didn't have some great thoughts. So I knew something wasn't right then.
Were you ever suicidal, you said, or?
I had a thought or two. I mean, I don't think I would have ever done anything, but I had a thought or two. Yeah.
Yeah. And how about your family history? Where do you see this running in your family?
My mom has
Your mom,
depression.
you told
Yes,
that, yeah.
you actually diagnosed my mom with depression. And then my grandmother, she, on my mom's side,
Right.
she had depression too that went undiagnosed.
Anything in the family history as far as bipolar or schizophrenia?
So my grandmother thought her mother was schizophrenic. We don't know. And then my little brother was diagnosed about 5-6 years ago with paranoid bipolar schizophrenia. But now it seems to be more of paranoid bipolar. So.
And which side of the family is the schizophrenia bipolar? Is that mom's side or dad's side?
Mom's side.
And how about dad and dad's side? What's going on?
Dad's side, just a lot of anxiety,
Okay.
which we all have.
Do you take more after mom or more after dad, do you think?
Depends on what it is.
Looks, personality,
My dad.
right? How about your brother?
My mom.
That. So I talk about this a lot about genetics. So what happened, and the reason you're fortunate you don't have bipolar, you're not schizophrenic, is because of genetics. And so the number one cause of these imbalances is genetics, number one. And what happens is you typically take more after the side. You take after both parents, of course, but you take more after the side that you look more like, and then you act more like, whatever parent you can relate more to. And you get some from mom's side, but not you got a lot more from. So I call it like a bigger genetic load from that side. And your brother was unfortunate to get from your mom's side. That not your mom herself, but grandparents and things like that. And back then, they didn't really have anything to do to treat it either. Nothing great to treat it, so it was pretty bad. They have ECT, they had hospitalizations and things like that back when, before meds. So that's genetics is the number one reason, which is why it's not your fault. It's nobody's fault that they have these things. It's a medical condition with a medical treatment, and that's what these medications are. They're not addictive. They treat the underlying problem that your body just doesn't do on its own. It can't do it on its own.
Yeah.
Period. The second factor is hormonal changes, so puberty. So this is why a lot of times this starts, right around late elementary school, middle school, right in those years, right, puberty, because the hormonal changes set it off. And we also see hormonal changes. Some women premenstrually, so some women will say, the week before my period, I really don't do great, and I do better after. Well, what's going on is serotonin is dropping down when estrogen is dropping down at the end of the cycle, and it throws things off a little bit. Postpartum, the reason some women suffer with postpartum depression is, again, that abrupt hormonal change from being pregnant and then not being pregnant. And then that abrupt change is what sets off a lot of women who struggle with that after pregnancy. And then menopause, men have it a little bit easier because we don't have as bad, but we have same thing, puberty, and then I call menopause. Menopause means same time of life with women, but men also go through their own hormonal stuff happening in that time. And so men also mood can suffer during their hormonal change time. So the good news about medications is, like I said, is just that, it's not throwing a Band-Aid at a problem. It's actually fixing the problem at the source. And then I've showed you diagrams with neurons and how they work, but you're on a really good combination. There's actually a few imbalances that these medications are correcting. I use a lot of Topamax. Topamax is one of my favorite medications to prescribe. I've been doing it for over 30 years now. It initially came out, initially as an anti-seizure medication, but they don't use it for that anymore. Mm-hmm. But migraine headaches prevention is a very common reason I give it. But the other benefit of Topamax is also weight loss a little bit, because it does curb a little bit of appetite, and it can help it helps with anxiety. Migraine, weight loss, and also, just physical. Sometimes just people say not just even the headache, but just muscle tension. My back and my head and neck, and feels a lot better. When you take that. So it's a very misunderstood medication. A lot of doctors don't understand it and don't know how to dose it properly, and how you have to do it slowly. You're on 50 milligram, which is a low dose. Most doctors think, you have to go at least to 100 milligrams of that one. Well, a lot of people get to 100, yes, or more, but not you. Because if we try to push you too high, you're going to get side effects. You're not going to get benefits from it.
Yeah.
So
we tried it, and it.
Yeah,
I
it made you
recall,
space.
But I just,
well, it's going to make you feel spacey.
Yeah.
Kind of foggy, spacey. Like forgetting words.
No, that's right. It did. I remember being at work, and I couldn't remember what I was doing from one minute to the next.
Right,
so,
right.
Yeah,
it's not good.
Yeah.
And we jokingly call it Dopamax or Stupid Max if we go too high, because it makes the brain people like, what do you call that? What's that called again? Right there, we're talking like Joe Biden, and so these are some of the signs of Topamax, or we call Dopamax. So, but good, yeah. But you're on a great regimen. And anything else you'd like to share with us?
I'm just grateful that Mom found you, because she's doing great.
Yeah.
She's, not depressed and yelling at us
You got
kids.
a great mom.
Yes, and I'm just grateful that you actually took the time to listen to me and all of my concerns and symptoms, and you tried one right after the other times probably 200, because usually one doctor will just say, here's the pill, take it, it should work, and they don't keep trying, and you tell them this isn't working, and they don't listen to you.
They don't listen, and they don't understand. You have to be aggressive, and aggressive doesn't mean dangerous. When I say aggressive, I mean you can't just say, here's 50 milligrams of Zoloft, and I'll see you back in a month or two. Now, a lot of doctors do that. They'll start someone on SSRI, and they'll say, well, it takes 4 to 6 to 8 weeks to work, which is complete nonsense. That's never been true. So right away, if the dose of Zoloft, within a week to 2 at the very most. And so when I say aggressive, I say, look, 50 milligrams, go right to 100. And if it's getting closer, go to 150, go to 200. But you have to kind of push it. The problem is if you go too slowly, people lose hope, and they say, well, it's not really working that well, so I don't want to take something that's not working. And then I think too many people, they take months and months to get to 200.
Yeah.
And who's going to wait that long? Nobody. And so that's why 200 sounds like a high dose. It's not a high dose. It's a normal dose for you. And it might be higher than other people, but you're not them, you're you, and so your individual needs are different, and then doctors have to be really sensitive to the fact that we need to figure out exactly what's right for you, and that's why it takes combining and mixing, and it's tough for patients who, I don't want to be on more than one thing. And I want to be I'm on 3 things now. Are you kidding me? Can I go back to 1 or 2? And I hear that a lot. Mm-hmm. And I say, well, I'd prefer you do this, if you want to do it. And I almost tell them, I said, if I have to prove it to you this way, by you doing that and me showing to you that's not a good idea, then we can do it. And then someone will say, okay, never mind.
Yeah.
Now that you say it that way, okay, I forget it. I'm just going to leave it alone. Yeah, I said, leave it alone. I mean, there's no. Are you having any problems? Do you have any side effects? No. Good. Just stay the course. Because each of these medications has their own role. If we took away the Topamax, you get the migraines. If we took away the Mirtazapine, you wouldn't sleep. We took the Zoloft away. That's a really bad idea. Zoloft's the most important of the three you take, but they're all important. They all have their own importance, and so. But anything else you'd like to share with us?
Just patients need to be their own advocate.
Very good point.
If something's not working and your doctor's refusing to talk to you about it or prescribe something else, you may need to switch doctors, and don't feel guilty for doing so. I have a friend who has been trying for the past 25 years to get her dosages right, and she's afraid to switch doctors because she feels guilty, and her doctor can't get her medications right. And, you're bipolar. No, she's not bipolar. It's like, so just, if you have to switch doctors. Don't feel guilty about it. Be your own advocate. And if it's going to take time. It's not just, here you go, this is going to fix you. It's going to take time to get the right combination. So be patient, log all your symptoms, report it back to your doctor, and just be patient. And it might take 5 or 6 medications, might take 2 or 3, but
usually 2 to 3 is average. 3 is common. But it's a very good point, and it's interesting, how people will stick with somebody, a doctor who's just not really helping them that much. And people will go to a different grocery store if they're not happy with the service, or if they go to a clothing store and the service is bad, you go somewhere else. People will switch things all the time. But why not their doctor? Well, because he's the doctor. And well, so what? If he's not the doctor, or he or she is not helping you, gotta look somewhere else. Because not all the, a lot of doctors spend way too little time with people, and a lot of doctors are, the person's in the room and they're typing the whole time, not looking at the person, no eye contact, in and out in a few minutes. Here, okay, good, take this book, goodbye. And don't listen to details. Don't take a good enough history. And in this field, that's all we have. All we have in this area of medicine is listening to patients, taking a really good history. It's all about the history. If you don't take a good history, you're not going to get the medications right. If you do, you may not get it right every time. Like with you, it took a few different times. But eventually you learn, okay, it's not this, it's got to be this. Yep, it is that. It's that, you figure it out. It's like figuring out a puzzle. I love doing this because I've always grown up loving puzzles and loving chess and things like that. And so this area of medicine came naturally to me because it's like solving the human puzzle and trying to figure out a person and the individuality, and it's fun. Actually, I really think it's fun. I enjoy it because it's fun. It's fun to do it, and it's fun to see the results. And it's really gratifying to see people's lives turning around. There's no other area of medicine that's like this. You can treat someone with diabetes and their blood pressure, and that's fine and that's important. But it's I never got the satisfaction with doing those things like I do with this. And that's why I chose to get out of family medicine years ago and move into this full time, because again I just wasn't getting the same satisfaction, and I wasn't seeing enough. I wasn't seeing people's lives turning around, and to me it was so exciting when I saw that. I picked the wrong field. I got to do this now. So. Well, thank you so much for coming in. I really appreciate it, and really enjoy working with you over the years, and hopefully another 25 or so.
Another 25.
Well, Jennifer, thank you so much for coming in. I really appreciate it. Thanks.
Thank you so much.
So in Jennifer's case, again, I tried Effexor, didn't work out. I tried Wellbutrin, didn't work out. So obviously, and I probably started with Effexor, but what I learned is that, I might sound like I'm not a fan of SSRIs, but actually I have a lot of people on them because sometimes they are the best one. And Zoloft in her case is fantastic for SSRI. So basically just working on serotonin and then getting that balanced. Remeron is a unique medication. It's an antidepressant, but it also works on a little bit on norepinephrine, not just serotonin. But it's also really fantastic for sleep quality. And she's also on Topamax. Now, in her case, Topamax works on GABA, but it's a very unique medication. Not only do I use it for anxiety and for weight loss, but when you balance GABA, in her case, it gets rid of her migraine headaches, it helps her anxiety, and then also the benefit is that it can keep weight under control. And because Remeron, mirtazapine for sleep can cause a little bit of weight gain, so sometimes I'll just throw Topamax in the mix if people are doing really well, but they're struggling with appetite, because some medications can cause weight gain. So Topamax, I use so much Topamax because it's a really great way to not only it's not really meant to be a weight loss product. It's very good for it, but it also is not just that. It's for anxiety, for pain. So it's just a very utilitarian drug that I use a lot of. So in her case, she's doing really well in that combination of those three. Hello.
Hello, Dr. Corona.
Hey, how are you doing?
I'm doing fine, thanks.
Great. Thanks for coming on. I really appreciate this.
Sure.
So if you could share with us about your history, what happened in the past, what led you to see me in the first place, and how have things gone since then?
Okay. So basically, when I first started having depression problems, I saw a doctor who was struggling to find medicines that worked for me. Mm-hmm. And I went through lots of different medicines, and it didn't really work. And I heard about Dr. Corona from a family friend and a family member, actually, and read some of his book prior to that. I can't remember the name of it. But it talks about combining medicines and how that worked on your brain. So when I came to him, we started with a combination of medicines, and that really helped me. As time went on, sometimes they stopped working, and I would call Dr. Corona, and he always had something for me to try, and it almost always worked. Over the years, we've had to change things and try things, and he's always been real helpful with that. But it seems like we finally actually have it right at this point in time. Didn't take that long, but it's going really well.
Well, this is Dr. Corona speaking, by the way. So just that. When you were mentioning that, it sounds like you were talking to someone else, but it's me. So.
Oh, I know it was you, but I thought I was talking to a different thing.
Oh, okay.
I misunderstood how this went.
Well, I mean, it's been such a pleasure working with you over the years, and your family, but yeah, I think after I'm on the call with you, I'm going to go to the whiteboard and explain the neurochemistry, because I think you're on a combination now of Pristiq, Wellbutrin, Abilify, and Lamictal, which is one of what I call the Corona protocols, but it's you're on a really complete mix, and I think that it did take a while. It can take a while. I mean, I don't always get it right the first time. I mean, this is trial and error. What I do, we don't have blood tests to follow. We don't have anything on paper to say, oh, here's what you do. It's all about listening to patients, like yourself, and trying to get clues, and then trying things. And then I say, okay, let's try this. And then I feel like, okay, well, that didn't work. Okay, well, and then I have to rethink it again, and then I have to, then I have to try that. And so, but normally when I get something, and if I don't get it right, whatever the patient tells me, I'm able to kind of get clues. Okay, I think I know what it is now, and so it's all I call it rational trial and error but it's not like just throwing darts at the dartboard. It's there's reasoning behind it. It's kind of but it can be frustrating sometimes. For people, and a lot of doctors, like who you were seeing before, they don't know how to combine things. They'll give you one thing after the other, but when you give something by itself, it's only going to get you so far. A lot of people, such as yourself, need to be on a combination, or else you're not going to stay stable. You're going to be better for a little while, and then it's going to fall out. And so
that's exactly what I went through.
Right.
For quite some time, and it was very frustrating.
How old were you? Tell us to go back to when you first started having any depression symptoms.
Oh gosh, I think I was in my early.
Early what?
I don't remember. My early third.
Okay. Yeah. Yeah. So.
You're cutting out.
Oh. So yeah, so it's been for a while then, and so that's been maybe over 20 years ago. So
she's cutting out.
I'm not hearing you as
okay.
good, but
we're having some technical problems. Yeah.
It's been about 30 years.
Right. Yeah. So, and the reality is, had you not gotten treated properly, you would have continued to live the rest of your life feeling that way. And we got to think about our ancestors, think about our parents and grandparents and people who never had access to these things. But because back then they didn't know about these things, and so a lot of people just in the past just suffered, and that's all they knew. Life. They just figured that's the way life is. You just suffer, and that's it. And thankfully, we live in a day and age now that people don't have to suffer with this. As long as we have to realize that this is a medical problem, it's a neurological issue. It's not something people make up. It's not a weakness in your character or will. It doesn't mean you're not trying hard enough. It's something you can't help, and it's something that's genetic. And so I don't remember with your family history, but I'm sure it probably runs in your mom or dad's side or both.
Right. It does.
Yeah.
My mom's side, yeah.
Right. So you couldn't help it, and she couldn't help it, and her mom couldn't help it, and so it falls down and goes down the line, and thankfully we have these miraculous medications now that are just able to get people to that place you're at now when. But again, it has to be done right. Everything has to be perfect. The doses have to be right. Everything has to be, and it takes a lot of tweaking. As I know I've done that with you. You go up, that's too much. You go back down. Then you've got to find what I call the sweet spot. Every medication you're on has a sweet spot. So, and you're on a low dose of Lamictal, you're on a pre-low dose of Abilify, so you didn't really need a lot of mood stabilizers, with your antidepressants. Right. So okay. Yep. Well,
what you've done has worked great for me.
Great. Well, that's why I love doing it. So, well, thank you so much for coming on. Well, thanks, Alec.
You're very welcome.
Thanks for coming. I'll talk to you soon then. Okay.
Okay.
All right.
Take care. Bye-bye.
So in her case, again, she was a little bit more complex than the average person. When she first saw me, other doctors had tried SSRIs, of course, because that's what doctors do. That's what they do. They tried Wellbutrin by itself. That didn't work. So basically with her, the first step with her was to put her on a Prestique. Because I already knew what hadn't worked. But I had a feeling that it was going to be more, in her case, because of her history, that it was going to be more complex. So we start with Prestique, and that worked well for her. Serotonin, norepinephrine, reuptake inhibitors, so that's going to get those two moving. I then added Wellbutrin, again, norepinephrine a little bit, but more dopamine, and then that's going. But she still, even though she was doing better, she still wasn't there yet. So now, again, just like when I talk about Rexulti and Vraylar and other things, so I knew that she wasn't there yet. So when you already kind of maximize the antidepressants, then I have to think beyond. I think, okay, there's a bipolar component here. So when people are talking about treatment-resistant depression or when Rexulti talks about that, what they're really meaning is that the person has a bipolar depression or a variation of bipolar disorder, and that I knew was the case with her. So I put her on Abilify, a very well known. It's generic for years. And so what that does is it basically it helps with dopamine, but it kind of helps to slow it down, and that calms the brain down. We call it dopamine antagonist. So it basically works well with Wellbutrin, kind of balancing it, so it doesn't go too fast, it doesn't go too slow. It has that perfect balance. And then lastly, what I did is I gave her Lamictal. So Lamictal is the only antidepressant that works on GABA. So I knew I would fix all these three, and I said, okay, I can't go any farther with her there. When I add Lamictal as the last piece of the puzzle, that really is what got the depression gone. It also helps because with bipolar depression, you can be better and then you drop, and then you can be better and then you drop. So we call it cyclical depression. Cyclical meaning it doesn't stay consistent. And then oftentimes when Lamictal, I call it the last piece of the puzzle because when I put that in, oftentimes everything is just better. And in her case, and then she's on a very low dose of that, low dose of Abilify. That's all it took. And if you try to push the doses up higher of things, then when they don't need it, basically you just get side effects. So you have to find the spot where you get the results without side effects. And so hers was a really good case because with a little bit of time and work, I was able to figure it out, and she's been doing great for a while. So very satisfying outcome. I hope you enjoyed the show today. If you have issues with mental health, or if you know someone who needs help, I'm available. If you want to contact my office, my website is drpaulcoronamd.com. That's DR for doctor. And you can also learn more about me on my website. My phone number, if you want to contact my office directly, is 949-481-0118. If you want to learn more about my methods and what I do, my latest book, I recommend The Corona Protocol, a scientifically proven medical solution to stop addiction, bullying, homelessness, school shootings, and suicide, 30 years in the making. In this book, I tell 30 original short stories about people. And I also have my first 3 books, Healing the Mind and Body, the trilogy, available online. I look forward to you joining me again on the next episode of The Dr. Paul Show.